welcome to my channel, The Ready Nurse Nay. Today's video, I'm going to be telling you about my clinical rotation in the OR. If you're new to my channel, I am a third clinical semester nursing student, and this semester I've done rotations in the OR, pediatrics, OB, and med-surg. I will be graduating in less than a year, and so I'm documenting my journey. And go ahead, subscribe and keep up with what's going on and be encouraged or entertained, whatever it is. And so my OR rotation, we only had one full day of OR rotation, which was it was fun. This was definitely one of the more enjoyable clinical rotations I've had. And so on this particular day, we were paired with like a nursing educator at the hospital, and there were several surgeries going on that day. I was surprised they have over 50 ORs at this major hospital that we were at. And yeah, it's huge. The supply room, the equipment room, the meds, anything and everything related to like surgery, they had available, which was, it's high tech, it's organized, and it is very sterile. The biggest thing, I guess, sterile field, and maintaining sterile field, and also like dressing in your sterile clothing. So like, say you get there to the unit, they have the locker rooms. We went to our locker rooms for, there's a locker room for men, locker room for women. You go to your locker rooms, you change into the scrubs, like your clean scrubs that they provide for you. And then, yeah, you're good to go. So I actually have some pictures of me in the scrubs, the surgical scrubs that I was wearing. I'll insert those pictures. So you'll actually be able to see them, because that was fun. I felt, I felt professional in my surgical scrubs and my surgical attire, with my bonnet on, the mask, all that stuff. You'll be able to see that. I'll insert that picture in here so you can see it. But it was fun. The surgeries that were going on that particular day for me and my clinical group, it was 7 students, 7 of us. They had a spinal surgery going on. They had a heart surgery. They had like a knee replacement surgery. They had multiple gastric bypass surgeries, and some other robotic surgeries. So we were all kind of assigned different things based on what we wanted to see. So I chose to see a gastric bypass and a gastric sleeve because those are some very popular surgeries. What I learned specifically, with those specific surgeries, is that the actual gastric sleeve, they cut basically half of the stomach off, and let it heals and stuff. And that's of course there's more to it, but they basically cut half of the stomach off of the gastric sleeve. And then for the gastric bypass, they actually kind of not necessarily remove a piece, but they bypass in a way that makes it smaller.
This is just a little picture kind of showing you the difference between the gastric sleeve and the gastric bypass surgery.
So if you're interested in those surgeries, I would say Google it to learn more about it. But it was pretty cool to see both and then learn how they're a little bit different. I was able to, in pre-op, you have your nurse pre-op and the patient, preparing them, getting the history and assessment and stuff like that. And then they're rolled into the OR where the anesthesiologist gets them all set up and puts the anesthesiology in them, puts them to sleep. And I guess the big thing that I noticed with the OR, it's like very clean and bland. There are no windows. The ceilings are very high. And because we were in a robotic OR, it was a robotic surgery, they have this weird kind of greenish tint to the lights. It's a weird color to the lights, and your eyes adjust to them, but it's just something that's a part of the OR with robotic surgeries. So it was a cool surgery to partake in.
This is just a general picture of the OR. It kind of have only what you need in it, and no windows, high ceilings, TVs to actually see what's going on inside the patient, and that's it.
Once the patient was set up, the circulating nurse, who is basically the one running in and out of the, she's not in the sterile field, she's running in and out, bringing materials in. She's kind of like looking at the computer, monitoring different things. There's a circulating nurse. There was a surgical tech. The surgical tech does a lot. She was actually like moving those probes in and out of the robotic machine. And she was in the sterile field, which was pretty cool. And then you have the doctors that were almost in like these little pods, controlling the robot that was doing all of the steps in this gastric bypass and the gastric sleeve surgery. And then you have the anesthesiologist, or the CRNA, who is at the head of the bed, monitoring the anesthesia. So everybody kind of has their own position that they're in, their own field that they're working in. They all work together as a team so that they can provide a successful surgery for the patient.
So this is kind of a generalized picture of what the OR look like in a robotic surgery. The doctors have the pods that are controlling the machine. The surgical tech is actually at the patient's bedside, and everything in blue is kind of sterile field that you can't touch.
So as a student, I was just kind of in there moving around, just observing, and it was pretty cool. They had the big monitor on one wall that actually showed exactly the scope that was inside the patient's body. You can actually see like what the robot was doing, whether it was clipping this or burning that, or stapling this or stapling that. You can actually see. So it's pretty cool. I was able to actually see inside the person's body. I saw their intestines. I saw their stomach. I saw, like, it was pretty cool. It was pretty cool. Like I say, it's very clean because it's a robotic surgery. There were no smells or no odors or anything like that. It was a very clean process. And then even when they removed, at the end, they removed the robot, and the doctors went and they closed the patient up. And then the circulating nurse and the anesthesiologist rolled the patient out into PACU. And PACU is basically where a person is recovering for a couple hours after a surgery. And once they're stabilized, they're moved onto a regular floor to continue, their healing until they go home. So it was pretty cool. It was a good experience. I couldn't do too much video, like I said, because there is a camera in all of the ORs. I would say it's probably for legal purposes and, sometimes learning purposes, where they're actually videoing the whole what's going on in the OR to make sure everybody's doing their job. Like I say, for probably legal and even learning. The OR was really cool. I had a really fun experience. I wish I had more than just that one day. It would be cool to see some other surgeries and stuff. I like the flow of it. It was smooth. I loved it. I enjoyed it. So hopefully this was insightful and entertaining, and I'll see you in the next video. If you like this, like, comment, subscribe, support the journey, support the channel. Let's learn and grow together. All right, and I'll see you in the next video. Bye.